Hello everyone, my name is Alex Bartkowiak. I'm a doctor of chiropractic and the clinical director of Health HQ here in sunny Southsea. Now, my primary aim with these blogs is to cover the big hitters, the big mistakes that end up causing the most common problems that we see at the clinic. And today's usual suspect is probably the sneakiest son of a gun of the lot of them, the hip flexors. Now, the hip flexors, as their name would imply, create flexion at the hip. Basically, they lift your leg up towards your chest. There are a few muscles that do this, but the two worst of them are rectus femoris and psoas major. Rectus femoris is part of your quadriceps, or your quads, the big strong muscles on the front of your thighs. Most of your quads attach just below your hip to the top of the front of your femur, the long bone in your upper leg, so they don't actually flex your hip. Rectus femoris, however, does go past the hip and attaches up onto those knobbly, bony bits at the top of the front of the pelvis either side. Psoas major starts very high up on the inside of the leg, then goes up all the way through the groin and then attaches to either side of the front of several of the lumbar vertebrae. Both of these muscles move your thigh and your torso closer together when they contract. Both can tighten up because of how we use them day to day, and both can mess up how your low back and your pelvis work together. Have you ever tried to stand up only to find that you're stuck, bent double, and groaning as you walk your hands up your thighs to help you stand up straight? Well, part of this can be inflammation in some of the soft tissues and structures in the low back, not taking kindly to being compressed as you become more upright, but part of it can also be your hip flexors that have set in this shortened position whilst you've been sat down, and now will only lengthen and let you stand up very slowly. There are a number of reasons why your hip flexors would tighten up. First of all, number one, exercise. Now, we've all at some point had some stiffness and soreness in muscles the day after we've done a bit more in the way of activity. The hip flexors do exactly the same, especially if you do full sit-ups, which are awful. Don't do them. And especially if you try and do lower abdominal exercises. Most of the time, people just end up making their hip flexors worse. If you want better abs and core, then check out my video on core strength and exercise. I'll put a link to it down in the doobly-doo. Second cause that the hip flexors might tighten up is sitting poorly. Now, wherever we sit, whether it's at the desk, in the car, on the sofa, we commonly end up with our shoulders in front of our hips, either from leaning forward or from slouching. Now, this puts our hip flexors in a more shortened position in which they can tighten up or set. Even worse if we sit on something low where our bum is actually lower than our knees. It puts you in a very bad position. And if you want to know how you might be accidentally making yourself worse just by sitting down, and some clever little tweaks you can implement to improve the way you sit, they're all in my post on how to sit like a pro. And I'll put the link to that in the doobly-doo too. A third reason why your hip flexors might be tightening up is protection. When an area of your body is suffering, whether from sudden direct trauma or from a slow continuous overworking, inflammation is produced. Now, inflammation increases pain levels to stop you from doing anything that would otherwise cause further damage to the area. It creates swelling in the area that makes it harder to move, and it also prompts the muscles in the area to all tighten up in order to help splint the area and protect it. Now, when your low back is unhappy, all the muscles that attach into it tighten up to protect it, including that powerful hip flexor, psoas major. So, as frustrating and as painful as tight hip flexors can be, unfortunately, the body usually has a good reason for making them tighten up in the first place. And it's almost always because of something that we've done ourselves. For that reason, trying to combat tight hip flexors with repetitive, strong stretching tends to be at best work poorly, and at worst can actually end up making things worse. Now, I've seen countless people at their wits' end, knowing that they have tight hip flexors, which are contributing to their low back problems, but despite almost constant stretching, they seem to get no relief. Fortunately, there are a few simple solutions. The best thing you can do is stop making them tighten up in the first place. Now, we all know the phrase, prevention is better than cure, and for these kinds of problems, it's especially true. So here's some do's and don'ts. Don't do full sit-ups, don't sit all scrunched up, and don't sit for too long. Do more core work rather than ab work. Do make sure that you're sitting properly, and do get up and mobilize every hour. Now, mobilizing every hour might seem like a lot, especially when we're all busy and we've all got work to get done. And I appreciate that we can't just stop and go for a wander or do a yoga class every hour, but fortunately that's not what I'm suggesting. My post on mobilization covers a full spinal mobilization routine that is tried and tested, very effective, and can be done in less than 30 seconds. Less than 20 seconds when you've practiced it and got really good at it. And again, I'll pop a link to that down in the doobly-doo. But I have a lovely little addition to those mobilizations, especially for your errant hip flexors. Now, I know it seems like I just said that stretching your hip flexors is wrong and then give you a hip flexor stretch to do in the next breath, but I'm not talking stretching, I'm talking mobilization. And if you have seen my post on mobilization, then you'll understand. Now, in a nutshell, we don't want to put a lot of pull through something that's already very tight, especially if it's painful and tightening up for a good reason. What we need to do is interrupt the tightening up process by simply taking it through its full pain-free range of motion, little but often. Part of the mobilization I run through in the Move It or Lose It post will already help to mobilize those hip flexors a little bit, but there is a little bit more that you can do with it, so I wanted to make sure that you have that in your arsenal too. To do this exercise, you need to stand up. You may also want to stand by something that you can use to stabilize yourself on. Pick a leg, either leg, and take a good step back with it, keeping a bend in both knees. Chances are that the foot you just stepped back with is no longer pointing forward and is now turned outwards a little bit more. It should be pointed forward, so here's how we're going to correct it. You need to look down your foot and then pivot it back so it points forward. Both your foot and your pelvis should now be facing forward again. The heel of your back foot might need to come up to do this, that's fine. And also, just by doing this, you may already feel a bit of a stretch through the groin of the leg that you've stepped back with. If you're not getting anything yet, or want to get a little bit more out of this position, drop down a little further and slowly send your front knee a little further forward and your back heel a little further back and down. This should add a little extra tension to your hip flexors. You don't want a lot of tension or pull through here, as you could end up pulling something and making things worse. You just want to bring it through full pain-free range of motion until you can feel it come to tension, pause for a beat, and then come back up and then repeat with the other side. Do this every hour that you sit for. It costs seconds, but it pays off massively. Now, if you have a wearable fitness tracker that reminds you to get up and move every hour, there really is no excuse. Even long car journeys, I always make sure that I find somewhere to pull in safely and to hop out and run through these mobilizations. It may seem like a faff, but the extra time it adds to the journey is no more than a set of traffic lights turning red on you would, but the difference you feel at the end of your journey is completely worth it. And I have numerous patients that have tried it out and are complete converts. And that's about it for the horrible hip flexors. Remember your do's and don'ts and to keep them mobilized, and you can save yourself a lot of potential low back issues and groaning as you get up out of your seat, which is not a good look. But like so many of these things, the hip flexors do not work in isolation and they do not tighten up and cause problems for no reason. So if you're getting problems, whether you think it's your hip flexors or not, go and see your chiropractor. Get it fully assessed, because you definitely don't want to be doing something that's going to accidentally make things explode or fall off. Now, we're always working hard to bring you information to make a difference and help you. So please help us by hitting that like button. Help us both by hitting the subscribe and the little dingly bell. And in the comments, tell us what you thought of the video and if there were any other topics you'd like us to cover or any other videos you'd like to see us make. But in the meantime, stay well, stay safe, stay mobile, and I'll see you soon. Bye-bye.